Welcome to Gist Nigeria from the BBC and Channels Television. And here on the program, we keep an eye on the stories making the rounds on social media. I am Wali Fakile. Let's start with our top story. Now, at least we all know a couple or two struggling to have a child in our community. They could be friends, relatives, or colleagues. They are part of the global 5 to 8% of adults who share similar reproductive challenges. Statistics show that in Nigeria alone, there are 10 to 30% of such couples. But in many communities, women are blamed for this and are often stigmatized. In this report, Gist Nigeria's Ajoke Uluotse speaks with some affected women. Have a look.
The shrill cry of the tiny one, a soothing sound in many African homes, where the arrival of a child usually signals continuity of a lineage. Its absence is believed to leave a vacuum, often seen as a failure on the part of infertile couples. The WHO says 15% of reproductive age couples in the world are affected by infertility, with higher prevalence recorded in developing countries. "44-year-old Made Adeboye was married for 16 years. With a biological clock slowly ticking, she tried 2 of the popular orthodox fertility treatment options, IVF and IUI. Made survived 8 IVF and 3 IUI treatments before birthing her children, a set of twins, through a journey she describes as very challenging.
It's been long, it's been stressful, it's been exhausting, it's been depressing, annoying, everything, all sorts of emotions.
But some are not as lucky as Made. Cassandra has been married for about 9 years. She has had 3 unsuccessful IVF treatments, but is still hopeful that one day she would bear her own children.
Emotionally, there's a lot of growth that comes from waiting for so long for something and not achieving it. And you just have to pick yourself up and live your life.
Infertile couples bear huge psychological and emotional burdens in Nigeria. With more pressure than support from society, they are stigmatized until their bundle of joy is born. Although medical experts say both men and women can experience infertility equally, the blame is often left at the doorstep of the woman, causing her to suffer more trauma.
I've had people come and tell me that, you are sitting down there, let me take you here, let me do this, let me do that. So, everybody comes to you. I'm sure my husband, not that I'm sure, I know people also met him and this thing, but in African society, I'm sure they will tell him, they'll say, oh, your wife.
It's not a female thing, it's a couple's thing. It's either it's from the woman or it's from the man. So you can only know that if you do a test.
Pressured by society and racing biological clocks, women often resort to all kinds of fertility treatments to birth their own children. After waiting 7 years to conceive, Joyce Aime gave birth to quintuplets using quite a costly option, the in vitro fertilization treatment.
My gynecologist now suggest as the year they roll and as woman now say age the woman side like man say okay, we'll try this other part. And as you know now, money not be small money. Now it's okay, make we wait now. We start to gather the money, small. And finally, as the money come, now it's okay, we'll enter this war where everybody they say okay, they do.
But not all families are as lucky as Joyce's at the first trial. Omotade Alalade and her husband took a loan to pay for their first IVF. Her joy was, however, short-lived after miscarrying the babies, coupled with the added burden of paying back the loan.
About 5 months into it, long story short, I ended up going into labor and I lost the twins. Now, the process of losing the twins was what took me from being a normal person to a mad person, in quotes. I became crazy. It's like the more days went by was the more I just started losing my mind.
IVF is expensive and out of reach for the poor, forcing some to explore far less expensive traditional options. For 21 years, Doris Wilson tried to no avail to have a child. But years of taking traditional herbs and massaging her womb eventually paid off. In 2015, she welcomed a set of twins. 6 years after, she gave birth to a set of sextuplets using the same traditional option.
The same way where the first twins take happen, now this one self take happen. The same local treatment.
The WHO says more than 186 million women in developing countries want to have children. But just how prevalent is infertility in Nigeria, and what are the causes?
Studies from the north, south, east and west of Nigeria show prevalence rates between something like 1 out of 10, as much as 1 out of 3. So the average is something like 1 out of every 6 couples are finding it difficult to conceive or to start their family in any given 12-month period.
There's a lot of belief that environmental factor, climate change, environmental factor, a lot of the things we eat, what is in it and stuff like that. There's a feeling that contributes. But most importantly, things like smoking, alcohol, which very, very common among reproductive age people, usually men, sometimes women, can affect fertility. So I think with that, also the things we wear, from the male point of view, when you wear things like tightly fitted pants or underwears, or when you travel long distance driving and stuff like long distance drivers, where there's heat directed to their private parts, can cause a lot of problem.
Who is essentially responsible for infertility when it occurs?
From research, it shows that it's equal. So 50% male factor, 50% female factor. So both can be the reason, really.
So, why are more women made to bear the burden of infertility?
I think it's a traditional thing because it's the woman that gets pregnant. It's the woman that delivers the baby. So traditionally, everyone looked at her. Is she pregnant yet? Is she? Not realizing that it takes two to make a baby. So I think that stigma, the bias and the blame, also it's been a man's world for a long time. So if you can blame someone else, why not? So that's why. But is it changing now? The answer from me is yes. The reality is more men are understanding male infertility, more men are coming forward for tests, more families are looking at the problem of infertility as a joint problem rather than her problem. My wife is not able to conceive. That's dying gradually.
Years of research have provided a number of orthodox fertility options for couples, improving their chances of having children.
Call it surgical approaches for either man or woman, where if the woman has blocked tubes in the past, we used to unblock them through surgery. If the man has what we call varicocele, this has veins surrounding his testes that reduce the way the testes functions, we used to remove them. And some women too, you have fibroids in the wrong places or other afflictions of the womb. Surgery can clear those ones and pave way for natural conception. The problem is some of these interventions are not so successful. So the frustration of infertility and its management through conservative and surgical techniques eventually led to the broad band of what we call assisted reproductive therapies.
When you find out that somebody is not getting pregnant and there's no problem with their reproductive system, you can offer them a lesser procedure called IUI. So IUI means you found out that there's no problem, you want to bring the sperm as close to the womb or the egg as possible. So you make the woman ovulate. Around the time of ovulation, you get the husband's sperm, and with a syringe, you put it inside the womb. IUI means intrauterine insemination of sperm, so that's it. Now, IVF is a more technical process. You need a lab, you've tried all the process, this person cannot get pregnant. So what you want to do is go and get eggs from the woman, get eggs from the man, put it together.
However, high cost of orthodox fertility treatments and the fear of uncertainties continue to deter struggling couples and have led families to explore the ancient ways. Traditional medicine practitioners claim they also record a level of success.
The success for this aspect of fertility cases we specialize on is 40%. Major area we have different causes of infertility. The major area of infertility we specialize on are infertility that is caused as a result of bacterial or fungal infection, infertility that is caused as a result of hormonal imbalance or unexplained infertility. So these are the area that we majorly have a good success when we treat women with such cases.
A lot of roots are with us here, and there's a lot in African countries that if you go, you get those things together, it will bring a perfect result. So for, let me say, on infertility cases, a lot of people, and a lot are still won't come. So if people can go one way, and it's not that maybe orthodox doctors are not the best, they are good, because when it comes to emergency, you go for orthodox medicine, you see the perfect side.
So the difference between science is that you can explain what you're doing. Sometimes with traditional you can't, and that's where the problem is.
No one deserves to be blamed for infertility, but how best can couples deal with it?
There is no need to blame anyone for infertility. It's a joint problem. Whether it's one person or the other, whether it's none or both, it is a family problem. And we advise people to own it, because the moment both of you own it, the solution is much easier, because you defeat the psychological stress that goes with it by coming together to own the problem.
You need to help yourself. And the way you can help yourself is by gaining knowledge. There are so many reasons why couples deal with infertility. It could be PCOS, endometriosis. It could be like, it's a large spectrum, high prolactin levels, you know, there are a lot of medical issues, and it doesn't necessarily mean you need to do an IVF treatment. It doesn't. There could be some lifestyle changes. There could be some other medications to take to help to solve the fertility issue.
Managing societal expectation as well as creating a support network for couples is crucial for families to weather this storm.
Society needs to be understanding of the fact that everybody's journey is not the same, and people need to sing about it. They need to, you know, do more movies about the fact that people have to wait, you know, and when you're waiting, it's not a bad thing. It's not a bad thing, you know. People are saying 9 months after, 9 months after, 9 months after, and the thing is, when you sing, you talk about it, everything, by default, everybody feels that it has to be 9 months. And when it's not 9 months, it's a problem. It becomes like a very big issue.
Studies show that having supportive social interaction with infertile couples reduces their stress levels and help improve their overall well-being. With a supportive rather than a stigmatizing society, infertile couples in Nigeria might easily find their way to parenthood. Ajoke Hulotse, Gist Nigeria.
All right, social support and not stigmatization is what these couples need. Do well to encourage them in any way you can. Still ahead on Gist Nigeria. 27-year-old Nigerian breaks stereotypes in the United Arab Emirates as a delivery lady. We bring you this story and more after the break. Stay with us.